Hello, everyone, and welcome to a breastfeeding class presented by the Breastfeeding Clinic in the Helderberg Basin, Cape Town, South Africa. Just a quick disclaimer. Information provided in this program is to assist you in exploring all available options, to empower you to make well-informed decisions, to help you feel in control, be responsible for, and have confidence in your choices. Information should please not be substituted for the diagnosis and treatment of any medical condition, and also please never disregard professional medical advice or delay in seeking it because of something that you have received in this program. And this recording is also not intended to replace professional or medical or other kinds of advice. Now, in this recording, we will be looking at the position of the baby, and I've highlighted it on the list of topics that we are covering in the breastfeeding class series. Now, positioning is how the mother holds her baby in order for the baby to attach to the breast. And if you remember this from a previous recording, positioning influences the way a baby attaches or latches, which influences the way a baby suckles, which influences the effectiveness and comfort of milk transfer, how much milk the baby gets with what degree of effort. Now, we will be looking at attachment and suckling in separate recordings. Now, positioning is key to preventing the top three breastfeeding related issues, which are nipple pain, milk worries, and latch struggles. Now, if you also remember from a previous recording, whatever position the mother and baby choose, it should be comfortable for both mother and baby, as well as effective, meaning the baby is getting the milk that they need. So, ineffective positioning can compromise a baby's ability to feed effectively. And effective positioning and a deep latch on will help prevent sore nipples as well as give the baby more milk for their efforts. Now, as mentioned before, apart from mother's comfort for latching, we want the baby to be comfortable. And this can be achieved with what we call positional stability. Now, this happens when a baby is well supported with their hips and chest and chin all touching the mother and no gaps in between them. Now, babies use up to 20 inborn reflexes, which can help them to get to the breast and latch on and feed. And these reflexes are triggered best when the baby feels pressure against the chin, chest, hips, legs, and feet. Now, Nancy Morbacher and Teresa Nesbitt in their program Natural Breastfeeding talk about pressure points on the baby's wrists as well. So they mention pressure buttons on the wrists, ribs, inside of the legs, top of the feet, and bottom of their feet. And these pressure points can be triggered best when the baby is feeding tummy down and the mother in a more laid back position. But also if the mother's sitting up or lying on her side, those breastfeeding positions that are traditionally taught. But in the sitting up and sideline positions, gravity makes breastfeeding a little bit more challenging because the mother's breastfeeding sitting up or lying on their side, the gravity tends to pull the baby's body away from the mother, creating gaps between them. And then the baby may become frustrated and upset when their feeding triggers are missing, when these pressure points are not stimulated. So the pull of gravity interferes with the feeding reflexes, causing the baby to arch away and fuss, making attachment difficult. So a baby needs this positional stability in order to control their head movements as well. Um, Imagine being handed a sandwich when you are walking on a narrow beam. You'll probably say, no, 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 not now. Wait until I'm stable. Because it's hard to think about lunch when you are fighting to keep your balance. Now, babies from birth up to 3, 4 months are totally reliant on positional stability to help them focus on a feed. So when positional stability are achieved, the babies will automatically move into this instinctive position, which is tilting the head back, leading with the jaw and chin to the breast, open their mouth wide, tongue down over the bottom gum line, ready to take the breast into the mouth, and then coming onto the breast with an oomph. Now, I have mentioned this before, because the breast is round, the baby can come from any direction. But for a newborn baby, we need to make sure that the baby's ear, shoulder, and hip is in a straight line, that the baby is held close to the mother's body, that the baby is supported at the head and shoulders. For the older baby, for a newborn, we want the whole body supported, and that the baby is facing the breast with the baby's nose to the nipple. I'll just recap that. Okay, so when you position your baby for a feed, notice with the baby's head and body are in line. We just look at the baby's ear, shoulder, and hip in a straight line. And we don't want to see the baby's head or neck turned to the side like this baby. So just for a moment, turn your head to the side, turn your mouth to your shoulder, like looking over your shoulder, and then try to swallow. It's difficult, no? And very uncomfortable. So imagine a baby lying on their back on the mother's lap or a pillow and having to turn their head to the side and try and feed like that. So we want the baby's ear, shoulder, and hip to be in a straight line. And we also want to see an angle at the back of baby's head because the head is then tilted back. We don't want to see a straight line from the back of baby's head to baby's back. And also notice if the baby is close to the breast with their whole body touching yours. And yeah, the baby in the slide who is turning his head to latch also needs to turn his both his hips towards his mother. And then the third thing is also notice that the baby's whole body is supported. And fourth thing is that the baby is facing the breast, approaching the breast from below the nipple with baby's nose to the nipple. We don't want the nipple to go straight into the mouth. Let's see why. Now, deep latch on is central for comfortable and efficient breastfeeding. Now, since breastfeeding involves taking a large mouthful of an even larger object, the way in which an adult approaches a large sandwich can be used as an analogy of how a baby comes to the breast. For example, with their mouth in line with the nipple or sandwich, or with their nose or top lip in line with the nipple. So imagine holding a sandwich directly in front of your mouth. When you open your mouth, you will see that your bottom jaw moves away. Now, in a baby at the breast with their mouth in line of the nipple, it will cause the baby's chin to lose contact with the breast, which we don't want. So just for a moment, and I've mentioned this now before, drop your chin towards your chest and try and open your mouth. Is it easy? Nope. So notice the position of your tongue when your chin is on your chest. Your tongue retracts from the lower gums and it actually humps at the back of your mouth, blocking the space where the nipple needs to go. So now tilt your head back slightly and open your mouth again. Notice you can open your mouth much wider and your tongue now lies flat on the floor of your mouth. So it's actually hard to retract your tongue when your head's tilted back a little. So some people even stick out their tongue to grab a sandwich when their head is tilted back like that. So tilting the head dramatically increases the size of the oral cavity, and the gag reflex is also less sensitive in this position. And again, we want to see that nice angle between the back of the neck and the baby's back. So starting with the mother's nipple on the baby's top lip will encourage chin contact with the breast and a wide open mouth for a deeper latch. And just FYI, the best triggers for feeding include number one, skin to skin contact, and then chin contact with the breast, and nipple contact with the fulcrum. And the fulcrum is that vertical groove between the base of the nose and the border of the upper lip. Now, when these cues, the skin to skin contact, chin contact with the breast, and nipple contact with the fulcrum, when those are given, a hungry baby will open wide, extend their and lower their tongue and grasp the breast and seal with their tongue and lips on the breast and begin suckling. Now, if a mother is going to feed the baby in the more reclined position, she can lean back and support herself with pillows. and she need to lean back far enough for the baby to be fully supported on her reclining body, but she shouldn't be completely flat. And the baby can be naked with a nappy on and lie tummy down on the mother's naked chest for skin to skin contact. And this is very useful for a baby who has difficulty attaching to the breast or is restless or is crying. In this position, if the baby is lying with their naked chest on the mother's chest, it often calms the baby down. And the baby might find their own way to the breast, the same as any fresh newborn baby can. Now, I often start the baby between the mother's breasts, almost like going to a restaurant and you are waiting for the waiter to show you the table. And when the baby shows signs that they are ready to eat, they would start bobbing or sucking their hands. And then I tell the mother to gently move the baby's upper body so that their head is over the breast, but keeping the baby's body and hips in contact with the mother's body. And the baby's head is often then cradled in the mother's arm on the side that the baby will be latching. Now, many mothers just instinctively support the babies between their legs with their arms coming over the baby's back and the palm of their hands holding baby's lower bum and their fingers between baby's legs. And baby's face can rest on the mother's bare breast, and some mothers will shape their breast like a hamburger to encourage a deeper latch, and others will just press gently on top of the breast just to tilt the nipple so the baby can feel it on their upper lip. And babies will lift their head and dive into latch, chin first. And positions where the baby is tummy down on the mother's body is thought to aid the release of those primitive neonatal reflexes, which are necessary for successful breastfeeding. And in the tummy down position, all the little pressure buttons are stimulated on the wrists and ribs and the inside of the legs, top of the feet, bottom of the feet, helping the baby to feel more stable and to be able to orientate and to focus on the latch on. Now, babies are hardwired to be tummy feeders. A baby that is more, if the mother is more in the upright position, um, the babies might battle at the breast. For example, there's a reflex referred to as the arm cycling reflex. It looks like the baby's fighting to latch, and the mother may give up, assuming the baby doesn't want to breastfeed. But the moment the mother lies back, that arm cycling reflex that seems to interfere with latching, when the mother is lying back, it actually assists the baby to latch on, and this arm cycling reflex seems to disappear. Um, and breastfeeding often improves in a more semi reclined position, not because gravity is helping to slow down the milk, for example. The milk flow depends on a vacuum created by the baby together with the oxytocin reflex contracting the muscle cells in the alveoli and squeezing out the milk. Breastfeeding improves in a semi reclined position because the baby in the tummy down position are positionally more stable and they are better able to coordinate or cope with their sucking, swallowing, and breathing. And all newborn mammals are uneasy when they are placed on their back. It's just us as adults, our mature nervous system allows us to be in control of our bodies no matter what our position are. So we're comfortably on our back. We can lie comfortably on our backs. Also, a newborn baby's spine is kind of curved, which makes them flail like a turtle on their back. Was another reason why babies want to be tummy down feeders. Now, babies communicate with their hands. This is a sensory homunculus. It just shows that our hands and lips and tongue is enormous in this because they have more sensory neurons than any other part of the body. And we know that the baby's mouth is very sensitive. But looking at this homunculus, it should now make sense that the baby's hands take part in feeding as well. So at the breast, the babies use their hands constructively to communicate and orientate and to stimulate milk flow and to calm themselves down and to stabilize and to help themselves find the breast. And parents will often comment that the baby's hands are in the way when they're trying to latch the baby. Meantime, the baby's just trying to help themselves. So during a feed, don't trap the baby's arms or use mittens to cover the baby's hands. And don't interfere with the hands unless the nipples are really sore. because if you interfere with their hands, it can actually disorientate and confuse the baby. And if the babies are trying, if the nipples are sore, and the newborn keeps grabbing it, if you want to limit this tactile searching, just keeps baby's face in contact with the breast. Then they don't need to use their hands to help them search for the nipple. A shortcut latch is to bring the baby's arms to hug the breast and to have the baby's chin on the breast and the baby's fulcrum, that little vertical groove between the nose and the upper lip, have that the nipple touching that. And if the hands are still too quick and in the way of latching, I just gently pull baby's arms out of the way by holding onto baby's sleeves rather than touching the baby's sensitive hands. Okay, so I have spoken about babies using 20 inborn reflexes which can help them to get to the breast and latch on and feed. Now, most of these are triggered best when the baby is tummy down. I just want to lift out a few reflexes that the baby is born with, and that they actually depend on for feeding. The rooting reflex, sucking reflex, and the swallowing reflex. Now, the rooting, sucking, and swallowing reflexes happens automatically or reflexive in a healthy term baby. But taking the breast far enough into the mouth is not completely automatic when a mother is sitting up and gravity is pulling her baby away from her. So the rooting reflex is when we touch the baby's lips or cheeks and the baby would turn their head to the side or towards the touch. They would open their mouth, especially if the upper lip is touched, and this is the rooting reflex. So it's normally the nipple or the breast that that is the baby is rooting for, but it can be anything that's touching the baby's lips or cheeks. Parents are often amused when a baby roots on a parent's face and try to latch onto a parent's nose. So when a baby is close enough to the breast and takes a large enough mouthful of breast, the baby can bring the nipple into the mouth back against the palate, and this stimulates the sucking reflex. Anything that touches the roof of the mouth will elicit a sucking reflex. So I have seen mothers put their finger against the baby's lips, causing the baby to root, and then put their finger in the baby's mouth, causing the baby to suck, and then they say, see, the baby's still hungry. I feel way too bad to say it's reflexive. So I would just say, when in doubt, always be the good hostess. Just offer the snack tray and mimic offering the breast. And then the swallowing reflex. This is best triggered when the back of the mouth fills with milk and then the baby swallows. So a quick summary of what we've learned today. For baby's positioning at the breast, make sure that the baby's ear, shoulder, and hip is in a straight line, that the baby is held close to the mother, that the baby is supported at the head and shoulders, older baby, a younger baby, the whole body supported, and that the baby is facing the breast with the baby's nose to the nipple, aiming towards baby's palate. So in line, close, supported, facing. Thank you for watching this recording. In the next recording, we will look at baby's attachment or latch on to the breast. Please visit the Breastfeeding Clinic at www.breastfeedingsa.co.za if you would like to book a private consultation and receive the handouts or the class notes. And you can also navigate the class recordings easier from the website. And please feel free to subscribe to this channel for more breastfeeding class recordings. And take care till next time.